Going to work during the COVID-19 pandemic has placed frontline workers under immense and unprecedented pressure, putting their physical, mental and social well-being at risk. Dr. David Jimbanau is a senior medical officer at the Port Moresby General Hospital. He is currently manning the isolation ward. He says the current admission rate is unparalleled as the number of patients reporting to the ward and even the number of deaths have increased dramatically.
It's almost full over the last 3 weeks, so almost every day.
You lose patients?
We lose and we get them from ED and outside too.
Do you see severe cases die here every day?
Yeah, almost every day. Previously it's like one in a week. Now we are seeing more than one in a week. I think over the weekend we've got 5 or 6 deaths.
Over the weekend you lost 5 or 6, just this past weekend?
Yeah, like last 24 hours we just lost 2. The 2 empty beds in front, they just filled them up.
EMTV asked Dr. Jimbanau on what it's like for a frontline worker, especially during this surge, and how they are coping. His facial expression in response was enough to tell that they are pushed beyond their limits. And the frightening thing is that the surge is just starting. Dr. Jimbanau is the only senior medical officer as COVID-19 registrar at the isolation ward.
Good question. We just can't cope with it. I think some people have been working more than 24 hours and we've got a number of workers who are also infected, and I think the same people are working more than 24 hours, taking the other shifts too. And I'm by myself here, so it's like I'm 24 hours, 7 days a week here.
You work 24 hours here?
Yeah. I just go out for 1-2 hours and then come back. I miss my home, but I don't have choice. I'm the only one here. The other anesthetic team, they've got a couple of other registrars, so they usually change. But me, I'm full-time here, so yeah, it's a bit difficult, but we just have to do it. We don't have enough manpower too. That's the biggest issue.
While EMTV was being given the tour of the isolation ward yesterday, another severe case was rushed in. And this particular case passed on this morning. As a frontline worker witnessing firsthand the rise of COVID-19 on people, he is urging the public to be vaccinated.
Me too. First time I don't like to get vaccinated. But after seeing what has happened over the last 3 weeks, I went and got my vaccine last week. So I want them to go and get vaccinated too. People come in mild cases, but most of the people that died and got admitted here are unvaccinated, almost 99% of them. And after seeing them dying like that, it's quite scary. So that's why I decided to go and get myself vaccinated. So my message to the public is go and get yourself vaccinated to protect yourself. There are deaths every day, so please just go and get vaccinated.